I'm Dani Gasparini, and welcome to this segment of Penn Voice. I'm joined today by Marmi Bermudez and also Sosefina Pita, who are with San Mateo County Health. You both are with the Health Coverage Unit. Marmi, you're the manager, and Sosefina, you are the supervisor of the Health Coverage Unit. It's kind of a little bit of a reorg for the organization, and we want to make sure that all of our residents understand that everyone in San Mateo County is eligible to utilize your services under the Health Coverage Unit. So, Marmi, why don't I ask you to start off? Just give us a little description about what you provide to our residents and what is the actual Health Coverage Unit.
Dani, so the Health Coverage Unit, we're comprised of a team of dedicated and passionate county health staff who provide enrollment and application assistance to our county residents who are eligible for our public coverage programs like Medi-Cal, Covered California, our local kids program called Healthy Kids, our local adult health coverage program called Access and Care for Everyone. And residents are qualified regardless of their immigration status, and if they're working or own property, they're also qualified.
And I know you have a team of individuals who are bilingual and really service multi-languages, so that shouldn't be a barrier. But Sosefina, one of the things that I learned today when the two of you and I were chatting earlier is this isn't just a program for uninsured or underinsured. So, for example, myself, I'm covered under California, the Covered California, because I'm an independent insurer. I have insurance by myself. So I could use your services if I was looking for health coverage and saying, what's the best coverage plan for me? Because as we all know, there's a lot of plans out there, and we don't necessarily know what's the most beneficial to us as individuals, families, et cetera. So explain a little bit more in detail about what's the process for someone to, once they call you, once they get onto the website, what you do.
Sure, absolutely. You know, someone as an individual like yourself is absolutely, you could use our sources to help you. You know, really families, individuals that are calling in, whether they're dropping in throughout the county for assistance, it's really walking them through the application assistance. You know, the forms are not as, simple to understand. We help them, assist them with filling it out completely into its entirety, submit them to the entities that are going to make the final determination, help them navigate their benefits. You know, it's comprehensive benefits, it's medical, dental, vision, as well as mental health. And not all those entities are under one building or source.
Or even one plan.
In one plan.
You're usually having multiple plans.
Really walking them through to understand their benefits once they're enrolled, and helping them maintain it, annually. You know, they must retain it going through different processes depending on what program that they actually qualify for. There's a different process for all those plans. So, and it's absolutely available to anyone that resides in San Mateo County.
Right.
You know, it's just a simple call. That you call in and say, hey, this is my situation. Every individual and family has a unique situation. And they simply just call in, and our staff are on there Monday through Friday, 8 to 5, picking up the phones and listening to what their unique situation is. And we actually, we filter through what their actual needs are as an individual, as well as in a family with children or with no children, disability, aged, whatever the dynamic is within the family, there is something for them, and we can assist them through that process.
I think it's important, Marmi, you had mentioned in the beginning, immigration status is not a barrier. So, and I think it's important that we say that, as well as we say, once again, language, there are multiple language assistants to help you. And then the other part that I just heard you say, Sosefina, is the fact that it's not just the application process, it's actually ongoing after that. So, as we all know, once we go and visit a physician or we see and receive medical services, the amount of paperwork that comes back to us, I'm not sure that I know how to navigate. Like, is it a bill? Is it not a bill?
Right.
Is this just a culmination of summary of statement and services?
Right.
What do I pay? What do I not pay? So it's important to know that you stay with that individual or family and assist them throughout their whole health coverage life.
You're right, Dani, and I think one of the things that I'm super proud of that this county has a department like ours is because we develop a relationship with our clientele, with the residents. You know, they develop a relationship where they're coming back every single year to do just that. Hey, what is this? Is this a bill? It doesn't say this is not a bill. Is this information? What are the changes? Help me understand this. And you know,
and even just the whole prescription coverage. Now you get almost on a monthly basis that your insurance or provider has dropped this particular one, or the, you know, what you used to get as a generic is no longer available. So even navigating just the prescriptive health is a difficult one. So I appreciate that you cover all sorts of things. When can you get eye exams? How often can you get a tooth cleaning? Before then it's out of pocket and it's not covered and things like that. So Marmi, what have you seen are the impacts to the county when we are striving for this more healthy county?
I think for San Mateo County, we've done a really great job. Like over the years, in our county, 98% of San Mateo County children have health coverage. And that's because of the partnerships that we've developed over the years. For example, you talk about the benefits. We work very closely with Health Plan of San Mateo. So when we have clients calling, we're co-located with Health Plan of San Mateo, so we're able to refer them. Do you need assistance with a billing problem? Do you have questions about your benefits? So we're able to partner with Health Plan of San Mateo and like Human Services Agency to be able to do that.
And I think it's important for our viewers to know that Health Plan of San Mateo is one option, right? There's Medi-Cal, there's Medicare, there's and you mentioned the youth and family or youth initiatives. There's so many different plans that various folks, because of their circumstances, might be eligible for. I'm not sure that I would understand which ones I'm eligible for. So that's what your job is, to help me understand what I am eligible for and to get me the best coverage possible.
And that's really what we're here for, Dani. Families have the option to, they don't have to come in person to apply. They can apply online, they can call to apply, they can apply over the phone, they can call and have an application mailed to them. So as a health coverage unit has also been our, we're very proud that we're also able to advocate for streamlining the processing, so families so families can have an easy time applying for these coverage programs.
We have to really understand most of our families are working, and so to be able to get down to someone and sit across and help with application assistance between 9 and 5 or even 7 and 10 is a difficult thing, but someone might be able to do it in their home or at a library off hours, which is a really wonderful, unique opportunity for access.
Absolutely.
Right. So when you look at impact for 98%, for example, of all children in San Mateo County have access to a health plan, what are some of the other impacts? Are we striving for, again, a healthier community so that the disease state doesn't kick in? So children are understanding about diabetes early on, heart disease. We are keeping our seniors enrolled in and accessing health care. What are some of those kinds of impacts that you're measuring?
So one of the greatest things that the health coverage unit has worked on is partnering with the schools, ensuring projects of such as 100% insured. You know, there's a program for every single child. There should be no child uninsured. And seeing how the nurses are able to navigate them to their appointments. What are their needs? Can I see in the front class? Students they're observing how students are improving even in academically because now they have glasses. Why do I have headaches? It's because, I have a bad dental issue that's related to this and I'm missing schools. One of the other things that I've seen a huge impact over time is the relationship that we've been able to build within our community, the trusting, the partnerships around the agencies. That is our biggest asset, is the community marketing us in terms of their experience, the positivity of the experience and what they've been able to do. And the families within the county are coming to us based on word of mouth, based on the experiences. I think that's a huge impact that we've seen. As well as one thing also to mention, Dani, is the partnerships amongst the different agencies. We're not a standalone. There's so many moving parts to healthcare. There's hospitals, there's the providers, there's
so many services within the county that you can then refer families to. Within outside of even just the medical coverage, the health coverage. Marmi, when's open enrollment?
Open enrollment for Covered California is actually now. It's from October 15th to January 15th of 2019. But if residents would like coverage starting January 1st, they would need to enroll by December 15th.
We are out of time, but I want to say to both of you, thank you for bringing this really important resource to our attention. I'm hoping that our viewers and anyone that's seeing us online knows the quickest thing to do is if you think you might need some assistance, just call. Just get on the website, in which we will put it up on our screen and our banner, so it makes it very easy for people to just navigate and look at it. So Sosefina and Marmi, thank you so much for coming and telling us about the health unit within San Mateo County Health.
Thank you for having us.
Thank you very much.
And we'll see all of you next time on Penn Voice.